All right, so we are here today with Amy Mills. She is with Birth to Three and works in physical therapy, and she's going to share with us just a little bit about what she does every day and her line of work. So thank you, Amy, so much for being with us today. We appreciate you.
Thank you for having me.
So tell us just a little bit about what you do and your typical day.
What West Virginia Birth to Three is a home or we go into daycare for an early Head Start facility. We see kids from birth up to 3 years old, and basically they have to meet a criteria to qualify for the program, and then we just work on any type of area that may be delayed. Such as if they're not crawling, or if they have tightness in their neck, or they have a feeding issue. And that's basically how we pick the practitioners and who needs to be on the team, is where their delay is in development.
Okay, so what would a typical day look like for you?
A typical day is I make my own schedule. However, it's quite a juggling act because babies have schedules and facilities have schedules. So I typically would start my day. I start my day 2 or 3 days a week at 7:30, and the other days around 9. And I try to go to daycares first because they eat earlier and they take an early nap time. Also, we have to work around patients' parents' schedules. So sometimes I may have a late visit. And we also have team meetings, which means everyone on the team will get together and have a meeting with the parent to kind of discuss progress and or anything we need to change.
Okay. So what led you to this career path, working with physical therapy?
I always wanted to do physical therapy from probably the time I was in 8th or 7th grade. However, I never envisioned working with children. Um, and it just kind of, I worked in the school systems for a couple of years, and then it just kind of evolved to working with babies.
Well, that's a good thing. So if students are interested in doing this type of career, what kind of schooling or background would they need to be prepared for?
Um, Physical therapy is actually a doctorate now. So they would probably need to get an undergrad in biology or health science or something like that. Um, to be the physical therapist, it takes about 8 years.
So definitely a commitment with school, and they would
Absolutely.
probably need to their enjoy taking science-based courses, math-based courses. Yeah.
Science, math. There's a lot. The prerequisites to get into grad school include physics, obviously, several human anatomy classes and the lab that goes with them. And math basically goes to like statistics and that type of thing as far as a prereq to get into grad school.
Right. So, what would you tell students would be the most challenging thing about working in physical therapy?
Well, this is what I tell my daughter is that physical therapy means that it is a physical job. Working with children is probably, it's not that it's not physical, but it's not as demanding as in other settings because, like in a rehabilitation center, you may have someone that's 300 pounds that you're working on a transfer. Um, Whereas birth to three, we basically go in and demonstrate what the parents need to be doing until we come back the next week and show them, you know, what to be doing. It's
Right.
basically an educational model versus a medical model where you're actually teaching someone to walk again
Right.
or rehabilitating a knee replacement. So physical therapy is actually a very broad, there's a lot of things you can do with a physical therapy degree.
So there's lots of options and different pathways a student could follow if they chose that.
If you choose physical therapy, you could do outpatient, which is more like sports medicine or at a clinic. You can work in a nursing home. which is what we call skilled nursing facility, long-term care, which you would be rehabilitating those people. You can do home health. You can work in the schools. You can do birth to three is very limited. I mean, that's not something a lot of people with physical therapy do. But you can. Um, and then you can obviously open your own clinic and do whatever you see, whoever you want to see.
So definitely a lot of options. What would be one of the more rewarding aspects of your career?
Um, I feel like in the setting that I'm in now is that a lot of times the parents don't really know what they're supposed to be doing with their baby or their child. So I feel like I really get to help them too along the way. And then I see a lot of the progress. Most all
Right.
of my children tend to get better, um, versus regressing, as you see sometimes in like the older population.
Right. So it's nice to see that you're making a difference, I'm sure.
Yeah.
Um, could you give the students some advice, maybe just life advice in general, or advice if they thought they were interested in this kind of career?
It's definitely now with the education requirements changing to a doctorate. It's definitely a commitment to go. It is basically 8 years of school, and then you'll have some type of clinical rotation, depending on which university you would go to, in which you're working a full-time job, but you do not get any pay. Um, However, I feel like it is physical therapy is a very rewarding career. Um, I know sometimes guys like to go into physical therapy to work with like maybe like a sports team,
Mhm.
and that kind of stuff. So that's fun. Um,
So definitely, there's a lot of options in physical therapy. It can definitely, I could see how it would be a positive thing and a rewarding type of career. So.
yeah, it definitely is.
Well, we want to thank you so much for just talking a little bit about your job and sharing with students a little bit about physical therapy. We really appreciate it, and thank you so much.
You're very welcome. Thank you.